We've heard a lot this morning and this afternoon for calls to action when it comes to Moonshot to be involved. You have our commitment and our partnership to make significant progress.
The commitment to partner and counter Moonshot is something the global collaboration is really, really important. I think that coming out of this, we're going to have a serious conversation about that. It's very, really important. That's why the global health conference is about collaboration. I think that's the nature of it's something that come out.
Hello, my name is Vivian Kopsinger-Birchall, and I'm with a team from the Global Health Catalyst Summit to talk about the upcoming Global Health Catalyst Summit. Gentlemen, please introduce yourselves, and we'll take it from there, starting with Dr. Ngwa.
All right, thank you so much, Vivian. Very excited to be here and to talk about this year's Global Health Catalyst. So I'm Dr. Wil Ngwa. I'm the founding director of the Global Health Catalyst. Started at Harvard in 2015, and currently I'm one of the principal investigators from the NIH that has funded the program, and now has extended that to other institutions and with other partners. And we call ourselves the Three Musketeers. So I'm going to hand over to the next one.
Hi, everyone. My name is Stephen Avery. I'm from the University of Pennsylvania, one of the Three Musketeers of the Global Health Catalyst Summit. Started in Harvard, where I met Dr. Ngwa, and it has spread and grown, and so happy that we're hosting it here at the University of Pennsylvania. It's going to be an exciting event. Really looking forward to it, and it's really going to show the expansion of the Global Health Summit from the very beginning to where we are now to where we are going to go.
Hi, thanks, Vivian, for inviting us, for this conversation here. My name is Saiful Huq. I'm actually the third musketeer who joined the founding father of this Global Health Catalyst, Wil, and then Stephen Avery. I'm from UPMC Hillman Cancer Center. I'm a medical physicist. I'm the director of medical physics program here. So I have, I was born in Bangladesh. Came here 40 years ago, got into medical physics. I have a lot of interest, like my two musketeers here, in really seeing how we can help develop the global health program globally. And that's why we are here, to talk about this and this year's Global Health Catalyst program.
For the benefit of those who have never been a part of the Global Health Summit, what is its background? How did it start?
Yeah, I think I can take that. So basically in 2015, we were looking around. Obviously, I want to mention that I was born in Cameroon. So at Harvard, we were looking at ways that we can, bridge disparities in access to cancer care, because if you are born in a low and middle income country like Cameroon and you have cancer, we recognize that you usually high chances you're going to die a painful and distressful death, versus if you are born in Boston, you have a lot of centers where you can go to, you have a choice, and so that kind of disparity, like Martin Luther King says, health injustice is one of the most inhumane. And so we started thinking about how can we collaborate to address these disparities. And so we got some initial funding from the Harvard Radcliffe Institute to host the first event. Basically, it brings people from high-income countries and low and middle-income countries to collaborate, to find ways we can collaborate to address disparities. And out of that, has grown, this yearly event and very high impact collaborative initiatives that have had an impact. And so, this summit today, like Stephen mentioned, this summit this year that Stephen mentioned is going to be part of that extension now. It's gone to many institutions, and now it's going to be at the University of Pennsylvania. So just to summarize, I mean, if you want to ask one word when you come to the summit, it's collaboration, collaboration, collaboration. You have to underline that.
Well, getting into the collaboration part of it, what is this year's theme, and why was that theme chosen?
Well, this year we were thinking about different ideas. And I think one thing about the Global Health Summit is that it's like no other meeting. I think once you attend this meeting, you know that I've experienced something new. This is something totally different. I remember that we had some funds that we received from Penn Global back in 2018, and we were able to host a meeting in Tanzania where we brought together people from different walks of life, different backgrounds. You could be a policymaker, a scientist, just a nurse, a physician. And I think that's really what the spirit that we try to embrace in the Global Health Catalyst is that cancer affects everyone. So everyone needs to be at the table to discuss how we can address it. And so our theme was, we were thinking of Ubuntu, where we kind of I am because we are, which was Nelson Mandela had discussed. But then we really wanted to really highlight what's happening now, and that was the cancer moonshot. It's where that's really focusing on trying to address cancer and try to find a cure for cancer, not just locally but globally. And similar to what PEPFAR did for AIDS, is where we believe the cancer moonshot will do for cancer, is to really address just the needs and just really the pandemic. Before COVID, this really was in many countries, but that is really happening around the world. And so the theme this year is Cancer Moonshot 2.0, how the win-win collaboration for global health and development, how we can work together to address this issue that affects everyone around the world.
Yeah, so let me take us back a little bit, back to the Cancer Moonshot. What is that, for the benefit of those who are hearing it for the first time?
So the Cancer Moonshot, so in 2022, President Biden reignited the Cancer Moonshot, and there are really two goals. Actually, let me step back and say that Obama was during his presidency that the Cancer Moonshot was first brought into law. At that time, President Biden was the vice president, and he was, the person who was in charge of it. And so when he became president in February 2022, he decided to reignite the Cancer Moonshot, which is now called Cancer Moonshot 2.0. And really, there are two goals. The first goal is to reduce mortality from cancer. So cancer death rates by a half in 25 years. So very measurable aspirational goal that we can all aim for. And then the second one was to enhance or improve the experience of those who are surviving from cancer. And so we actually think that, it's easier to realize these goals in low and middle income countries, where the big issue there is more of access rather than innovating or finding a new cure. Let me give you an example. Cervical cancer, for example, is the leading cause of death in Africa, but it's completely preventable. So all we need to do is go to women and give them access to, the prevention, the screening, and the treatments that they need. And if we can do that, we can basically in 25 years eliminate cervical cancer. So that's actually very achievable in low and middle income countries. Now, and I want to emphasize and just highlight what Stephen said, to say that, collaboration, there's an African saying that if you collaborate, you go further. I also want to emphasize that we actually think that extending the Cancer Moonshot globally, we can actually achieve that goal and benefit. It'll be win-win, like Stephen mentioned, where the United States can also benefit. And that's really the new approach that we are also bringing to global health, is that, it's no longer foreign aid. High income countries like the United States also benefit. And so if we can collaborate together, we can achieve the Cancer Moonshot goals.
Which is a great segue into the next question. What are the expected outcomes from this summit?
Let's take a step back. And before we come to this year's Global Health Catalyst program and its outcome, as both Wil and Stephen mentioned, one of the main goals of this this global health catalyst is to catalyze collaborations and really to help improve the access to care and reduce the burden, the disparity that exists in low and middle income countries. So there has been a Lancet Commission report that was published recently for the Sub-Saharan Africa, and my two esteemed colleagues, Will was the lead author and Stephen was a co-author of that. And that came up with a lot of recommendations as to how to address the challenges that exist in Sub-Saharan Africa. They said that by 2030, the death rate will go from about 500,000 to about 1 million. And that's a major problem. And the report has outlined major recommendations as to how to what are the different steps to take to reduce that. And so this current global health catalyst and the previous one, they're focused on into US Africa based relationship and how global health catalyst, these initiatives can really implement some of the recommendations given by Lancet Commission report, really to reduce the burden of cancer in Africa. But as Will mentioned, one of the main theme of this is the Cancer Moonshot 2.0, right? So, it's much easier to reduce the burden, the death rate by 50% in 25 years in low and middle income countries than say in the Western countries. This Global Health Catalyst initiative that you will see this year will not only focus in Africa, but it's actually broadening this to the rest of the world. We have already initiated some collaboration, catalyzed collaboration, right? Global Health Catalyst. We have, in South Asia, in Eastern Europe, in South America. So there will be, discussions, from those countries as to how we are, helping to develop collaboration so that we can actually establish processes and infrastructure and maybe take the advantage of AI-based information or advanced information, technologies. We can build, say, for example, an infrastructure in the cloud and use AI-based platform or AI-based tools actually to help facilitate, reduce the cost of the development of and affordable technologies that will help in reducing the cancer burden in those countries. So there are many ideas that Global Health Catalyst has, and through these the workshop, the meeting that will happen this year and in future years, our goal is really taking this Cancer Moonshot theme outside of the boundary of North America to globally.
That's a very, very exciting, and you touched on some of the questions that I was going to ask, but this is another segue into the Cancer Moonshot 2.0. We are throwing this term around because we are familiar with it, but how is this team collaborating with the founders and authors of the Cancer Moonshot, who are the White House?
So again, I think that's a great question, Vivian. Just to kind of say that, the Cancer Moonshot was reignited by President Biden, but really it's one of the focus there is, the White House the government can only do so much, right? So there's actually a really important part for the private sector. So I give you an example in the recent US Africa Summit, through some of the collaborations that we had, the White House was able to announce over $360 million in funding commitment to support cancer, extending essentially the Cancer Moonshot to Africa during the US Africa Leaders Summit. 200 million of that was from the US government sources, and 160 million was from private sector. And so, there is a lot more commitments that can be made. It's really kind of created this momentum. It's a step in the right direction, but it's a lot that needs to be done. And so when we had the summit at Johns Hopkins last year, we actually had the Cancer Moonshot office was present, and they did establish commitment. And your prior interview that you've actually made you've seen they made a commitment to collaborate, to kind of extend this globally. So Cancer Moonshot 2.0 is essentially, I think the big theme there is to extend the Cancer Moonshot globally. So it's beyond just the boundaries of the United States, like Saiful mentioned. I would say that there is already, the Lancet actually branded that. They call it the Cancer Moonshot 2.0. So, which is really saying, okay, we have this thing in the United States, but can it be bigger? Can you go take that beyond the boundaries of the United States? And we argue that, yes, you can. Actually, it's a win-win approach. It's a way that can also benefit the United States. And we can go further by collaborating. So, it's right at home here with the Global Health Catalyst, because that's our job, to catalyze collaborations,
Right.
If I can add to that, actually, we are planning to hold a Global Health Catalyst meeting in Bangladesh, sometime this year. And really, we've been talking about broadening the concept of Cancer Moonshot 2.0. The theme there will also be Cancer Moonshot 2.0. It's really globalizing this. It's a big effort, and it's a big initiative taken by this Global Health Catalyst.
Absolutely. And, the other entity that you have mentioned is the Lancet Commission, or Lancet, I don't know whether the commission itself that was launched in Sub-Saharan Africa last year. What is this relationship with the Lancet? You've also mentioned that they're partnering with the Cancer Moonshot 2.0, just for the benefit of everyone else watching.
Yeah, I guess maybe I can answer this question, is that if we look at the structure of the Global Health Catalyst, it's really of the summit. It's 3 days, but each day it's almost an individual meeting in itself. So we said the theme is Cancer Moonshot 2.0, but day one would be catalyzing U.S. and Africa collaborations for global health, and in that is where we talk about the Lancet editor, David Coleridge, would be say one of the chairs of the session, where we talk about this Cancer Moonshot 2.0, and he'll give a description on like what does it mean, and how does it fit into the U.S. Africa Leaders Summit, which Will had mentioned. And then that will be part of like a panel discussion that we would like to have with the first ladies in Africa, as well as in some of the young African, some of the African ambassadors too, where we really focus on, okay, now what can we do in order to build the U.S. Africa collaborations? And then day two, we look at catalyzing global collaborations. I think Saiful had mentioned like different parts of the world, Southeast Asia, Eastern Europe, South America, the Middle East, where we extend the same idea, as well as look at some of the cancer societies. How can we work together and partner underneath the same kind of umbrella of this Cancer Moonshot 2.0, and also looking at some other innovations, using phytomedicines and other things to address some of the new ways that we can attack cancer and help to alleviate some of the issues. And then the third day, we're looking at local collaborations. It's because global health is local health. That's another theme that we kind of were playing with too also. But it all fits under the same umbrellas. That now let's look at some of the religious organizations, the nonprofit groups, the community leaders, and how we can come together with some of the diaspora and other universities to address some of the local issues. Because some of the local issues that we see and some of the global issues that we see are related. If someone is in a rural area and you are addressing some of the ways that they can have access to care, it's very similar to someone who lives in a rural area in the States too. So there's some commonality there that we can address. And then finally, how do we bring in the young catalysts? How do we bring in the next generation? We have to create a pipeline of the next leaders and help to mentor them and bring them up. So once the Three Musketeers retire, the Three Musketeer Juniors that come along and take our place. And so I think that all of this is important. All of this is related to the Lancet Commission report and some of the recommendations that we highlighted in there.
This is fantastic. And, again, when you're talking about creating structures for the future musketeers. One of the things that I would love for this team to at least tell our viewers or inform our viewers is some of the amazing outcomes that have come from the Global Health Catalyst. We've had the world's you call it the premier comprehensive cancer center, which is amazing. We have the tumor boats in Cameroon. I don't know whether there's been an expansion beyond Cameroon. Such initiatives. We've had the Faisal Medicine Institute. Could you please mention some of these so that people can understand the power of the Global Health Catalyst Summit?
So one of the things that we really focus on infrastructure development, capacity building, education and training, so that we can really, as Stephen mentioned, the next generation of young catalysts is through education, training, and research. It's through those who will be able to build the next generation of people. So Global Health Catalyst, we have different program. In the education sector, say, for example, we have a global university. Through this university, we'll be able to really use the best professionals that are available from around the world and bring them close to home to all the people in different parts of the world as to who wants to learn. And they'll have access to the best in the world to learn from. So this Global Health University will provide that platform in terms of education, in terms of training. The other things that we do, and we're actually looking at it in South Asia, in addition to building this Global Health University specific education and training, we're also talking about establishing clinical trials. We are talking about enhancing the quality of care and reducing the burden of cancer. So we need to learn, by going to different parts of the world, as to how best we can help them. The cancer patients that you see in Africa or in South Asia are very different, than the cancer patient population that you see, for example, in North America. So we need to develop, processes and procedures to do high-end, high-quality clinical trials, both single institution as well as multi-institutional, both within the country, in a given country, and multi-country centric. So we are really taking initiative, in establishing some of these that will help, really increasing the access to care, cancer care, and reducing the cancer burden.
Let me just add to that. You really captured that well, Saiful. I mean, I think so Vivian, you mentioned the Comprehensive Cancer Center in the cloud. So because we're really collaborative driven, that's our focus. We want to create initiatives or outcomes that provide where you can collaboratively participate, right? So one of them is what you mentioned, which is the Comprehensive Cancer Center in the cloud. This was really launched as an outcome into 2017 Global Health Catalyst Summit. We had some funding from a number of organizations that really created this cloud-based platform Saiful mentioned initially with artificial intelligence, where you can help support cancer care even remotely. At the time when we started talking about this, people didn't really see the value. But when COVID-19 hit and everybody went to telehealth, it became very evident that we're actually futuristic, and now, it's become really this system where, like you mentioned the example of the tumor boards. So this is an example of care component where you can actually have an impact remotely just by getting on an online platform, using a communication telehealth. That has grown to other countries. So we actually have, initiatives that are going on, in Kenya, in Rwanda, and then there are other, with telehealth, the sky is the limit, right? Follow-up of patients, and then we do remote treatment planning and quality assurance support, using technology. We actually currently have, Saiful mentioned the clinical trials. We actually have an ongoing, as an outcome also from the summit, we have an ongoing multi-center clinical trial that is happening in 3 countries in Africa: Tanzania, Nigeria, and South Africa. And these are going to be extended, like Stephen mentioned. Now we're going to extend that to other world regions, including Southeast Asia And when we do that, we actually get on Saturday. We call it, I think Stephen came up with that, Global Saturday, where we get online and we are actually able to provide remote support to these doctors and oncologists and medical physicists who really need help, in implementing some of these things. And by doing that, we're actually being able to provide infrastructure for them, which Saiful mentioned, to really enhance the quality of care. We've been able to ship quality assurance equipment to other countries to support, and then finally, I want to mention, just emphasize the Global Oncology University as a, we have a big vision to actually create. So we have as a university to not only provide continuous education programs, which we've been doing for the past years already. Just last year, we had this partnership with Radiation Knowledge, where we had over thousands of people sign up, but prior to that, we've been training, people, literally thousands of oncology health professionals across the world. But we have a bigger vision to actually provide, degree programs, clinical certification, so that, we really kind of also harmonize. So the same quality of care that you're getting in the United States, you can get that in low and middle income countries. And I should mention that the education is a really great way where you can actually have win-win. We have residents who are joining this and they're learning, this bi-directional learning happening, and that's a benefit for the United States. I can tell you how many, this year I sent many of my medical students to Africa, but they are back and they are also participating in this. They are learning, it's part of their credits. They get credits for this. So, while you can always think about it as the benefit for, it's easier to see the lower middle income country benefiting, the high income countries are also benefiting. So I would just end by saying that there are really 4 areas where I think the Global Health Catalyst Summit's outcomes have really focused. So one is in care, so enhancing the quality of care. So that could be through telehealth. It's really one of our focus using information and communication technologies. In education, this is the second part, where we really want to build capacity, both continuous education plus degree programs. I'll just add some names so people just recognize them in this. Professor Ahmed El-Zawawi, Professor David Kay at Oxford. These are people who have been really instrumental in helping to also shape this. And then in addition to the education, we also have the research. So the clinical trials fall under that category. We already have some of them and we're going to grow that. One of the exciting themes we want to have this year is actually extending immunotherapy to low and middle income countries, which is just a big thing. People are very excited about that because, as you know, even in the United States, that's difficult to access. It costs hundreds of thousands of dollars. So people in Bangladesh or in South Africa or in Kenya, they may not be able to even afford getting an immunotherapy treatment. So we have people who are really excited to help us increase access to that. Then lastly, I'll mention so apart from care, education, research, one example where we are really active is really where we actually have the funding for currently from NIH, which is outreach. So we see the Global Health Catalyst Summits as a way to create outreach. It used to be that just us oncology people who work in oncology would talk to each other, and then we met you, Vivian, and other people, and we say, oh yeah, now we can talk to you and you can communicate to other stakeholders. Like Stephen said before, if we just talk to us as oncologists, yeah, we can do something. But we actually, when you come to the summit, you see that everybody belongs. You don't have to be a top doctor oncologist to participate. You can be a student, you can be an artist, you can be, everybody can contribute. You're impacted by cancer. And so that outreach has really been very successful beyond even what we thought, because like the Lancet Oncology Commission that we talked about is really coming out of that. It become a policy document that's going to help shape, policy recommendations for governments to follow, in many years to come.
Yeah, this is,
I just want to add a couple more sentences to what Wil just articulated, just to emphasize some of the power of this comprehensive cancer center in the cloud, right? Wil talked about the core care, outreach, research, and education, these 4 apps that we built. We, in the United States, we have very well-established clinical trial networks. And, a clinical trial is successful when the quality of in the clinical trial, in terms of radiation dose delivered, say, for example, and other aspects, when they're monitored very well. So here you have the clinical trial network, and the quality of it is monitored by a few other organizations. Like historically it was RPC, Radiological Physics Center, but it evolved into IROC Houston, IROC Rhode Island, IROC Philadelphia, and all of those. They really monitor the quality of the clinical trial, the patients who are undergoing clinical trial. Now, why do I mention this? We are thinking of a similar concept to establish in Africa now. Here is IROC Houston, and we lovingly, when we meet on every Saturday, we talk about we'll establish an IROC Africa. You know what I mean? And so really the idea there is we are thinking of developing a clinical trial network in Africa, parallel to what exists in the US, and also an like IROC Africa, if you will, and with the appropriate naming convention that will be coming. But they all will be on the cloud. Stephen mentioned, COVID taught us one thing: global health is local health, and local health is global health. We'll be able to monitor and establish high-quality clinical trials in Africa and in other parts of the world through the power of this advanced information, communication technology and AI-powered different, the technologies that will develop, which will be affordable.
Yeah.
Thank you. Dr. Avery, you wanted to add something.
Yeah, I just wanted to add
virtual reality, don't forget. Stephen wants to bring virtual reality to everywhere.
Oh yeah, definitely. Yeah. You know me too well, Will. I think as bad as COVID was, and I think the experiences, everyone has different experiences. I think any experience, you should try to learn from that and find something good. And I think what we learned is that at the time, I was the program director for our graduate program here at the University of Pennsylvania. And so again, COVID just shut everything down. And so we went to online, and we came up with a system where students can still come in and get some hands-on training. And in the end, it wasn't ideal, but students still were able to learn and still were able to move forward with their careers. And I think this is what, when we talk about Global Oncology University, is really that idea, because to build capacity with the present system we have now, we just will not make the numbers that are needed to address it. And so we have to change the paradigm. And so I think having the ability to do some online courses with some centers of excellence that we can establish where people can go to get hands-on training, combined with virtual reality, immersive learning, I think we see like this is, we have to use these innovations that we have now. So we can actually use immersive learning where we all can be in the same room, even though we're in different countries. And we can learn, and it's still the same level of education that you would get if you were sitting in a classroom. Not only that, it also brings together people from the diaspora in other countries where people may have left their country because they had to, but they still want to contribute. So this gives them the opportunity to contribute. It doesn't matter if you're from Southeast Asia or from the Middle East or from Latin America. Many people have to relocate just because they have to, but they still want to have a connection back with their country. And this kind of idea really allows that to happen, that I'm still giving back, I'm still contributing to the needs, even though I'm not physically there, because we all can't travel around the world and be physically there. We all can't build programs and sustain them, but this is a sustainable program. And that's another word I don't think we've said yet, is sustainability, is that whatever we really build, it has to last. Yeah. And so that's the other thing with the Global Health Catalyst. It's not one university, it's not one person, it's not one industry, it's a collective. And so if the University of Pennsylvania says we're out tomorrow, this is going to move on. One person or institution is not going to stop it. And I think that's what makes it sustainable. And that's what makes this model different from other models.
I like the whole concept of turning brain drain into global health gain. I think I've seen that you guys using that a lot. And this
I like that. Brain drain into global health. That rhymes very well.
No, this is amazing. I mean, what the themes that I'm hearing in our conversation is the innovation, collaboration, especially the win-win collaborations, networking, research, clinical trials, and most importantly, I think this program is designed to bridge healthcare disparities. And that's why we're all here, which is also very important that we have diaspora, regardless of It was started by an African diaspora, but we see Bangladeshi diaspora, and then Dr. Avery, you're considered diaspora, even though you were born here. I can't wait to see how the summit unfolds. But for the benefit of everyone who's watching us, where can they get more information about this summit?
Even you are the host, so you can.
My friend.
globalhealthcatalyst.summit.org.
Yeah.
And Global Health Summit is all one word, .org. And there you can get information about the upcoming summit, as well as past summits, as well as all of the initiatives we talked about, the C4, the phytomedicine, everything we're doing, past speakers, it's all there. And so I think that's a one-stop shop, like our Comprehensive Cancer Center.
So is there anything that we haven't talked about, we've left out, that you think is critical for our audience or for our viewers?
Yeah, I just want to add by saying that, and Stephen mentioned that already. So, really, I think the spirit of the Global Health Catalyst is that if you are somebody who feels like, I want to contribute, I want to participate in global health, I want to address disparities, I want to contribute to advancing the Cancer Moonshot goals, which is to reduce death rates. This affects everybody, or to increase the experience of those living with cancer. This is the place to come, because that's everybody can participate. It's the different part. When Stephen says it's different experience, it's true. You don't come to this, you can have the president, or first lady or ambassador sitting on the same table having a conversation with somebody who is a student. They are just discussing, somebody who doesn't even belong in healthcare. But anybody is welcome. Everybody can.
Somebody who does not belong in healthcare.
Yeah, like you were saying, we have people from sports and I know, like Calvin Johnson is very involved in phytomedicine, and he's regularly attended the summits. And again, it's not like he's just one of us. We're just all sitting at the table talking together, and it's you leave your ego at the door. It's not about that. We're all there for the same reason. And I think we're all there trying to address it and how we can work together. It's just not about who I am, it's about what I can do. Yeah.
Absolutely.
And if I may add to that, those of us who had the opportunity to live in this country, we all three are medical physicists, and we work in a discipline, we work hard, patient care is focused for us, and we all work to improve the quality of care to our patients, right? In this country, the level of treatment and quality of treatment has reached a certain very high level. And you have to work a lot to make a difference. And if you work a third of that for a low and middle income countries, the difference that will make is maybe 10 times as much. Yeah. So I join my two other colleagues here and the Musketeers to really welcome the younger generation. Yeah. And everyone else to join this movement that my dear friend, co-founder, will establish in 2015. This will go far. I mean, this has tremendous opportunities, and you will really make a major difference in the lives of patients in the world. So really, I want to welcome you all, to join this.
No, thank you. I can attest to everything that you have all said. I mean, it's like a magnet. I joined the Global Health Catalyst as a presenter at a panel in 2018, and I have never turned back. I'm just so excited to be a part of this process. I'm excited about the work that you are all doing. Thank you for all taking time to just tell us more about the Global Health Catalyst that is coming, and also the past. And we look forward to being a part of you and working with you and supporting you in every way that we can.
Thank you.
Thank you, Vivian.
And to our viewers, if you want to get engaged or involved, just reach out to this team at the globalhealthcatalyst.summit.org. Again, it's the globalhealthcatalyst.summit.org. Thank you for watching. Till next time.
Thank you. Bye-bye.